Hi everyone, today we are going to be showing a neurotoxin treatment. This patient gets a little bit of aesthetic talk. She gets her frontalis, glabella, and her crow's feet, and also a brow lift. She doesn't really like doing any lower face talk, so right now we are just sticking to her upper face, and we also do some TMJ treatment for her as well. She is a chronic clencher and grinder, so we do treat her superficial and her deep masseters. So that's kind of what we're going to be showing today. But right now I am just going in and I am marking up and just using a dry erase marker. People always ask what markers these are. This is just a regular dry erase marker. I find it comes off a lot easier than the skin pencils. So this just wipes off really nicely with an alcohol wipe or, makeup wipe. So here I am just going around and marking my crow's feet. I like to find that orbital rim with my finger and then just roll out just to make sure that I am away from that orbital rim and coming all the way around that orbicularis oculi muscle and making sure that I am treating wherever I am seeing where she is pulling. So again, I'm having her smile, and that very top injection point is nice because it's going to be able to pick up and lift a little bit of the corner of that brow as well. She does have a lot of hooding, so I do try to do everything possible to try to counteract her feeling any sort of heaviness when we're treating her frontalis. So coming down to my masseters, as you can see, I just have the borders marked. She has been getting her masseters treated for quite a while now. So they have atrophied a little bit and it becomes a lot more difficult to feel. So you want to, of course, always be going by your anatomy. So for the masseters, you want to be a little bit more posterior. I always find the edge of the mandible with my finger and make sure I am above that. And like I said, a little bit more posterior and staying away from the corner of that mouth. I always want to be slightly below, just because the risorius muscle does follow right along and it is superficial to that masseter. So when we're treating, we want to make sure we're going as deep as possible down into that muscle to avoid dropping the corner of their smile. For her deep masseters, I like to use my thumb and just find, it's almost like a little rainbow, I call it, right underneath that zygoma. And another position you can use to try to find that is also the tragus on the ear. A lot of the times it will be in line with the tragus. Of course, there's always, those patients that are a little bit different. Not everyone is exactly the same. So you want to be feeling, I have them clench and open their mouth and things like that, and make sure I feel that muscle prior to injecting it. But now we're just going to go ahead and start our treatment. My injection points here are about a nickel size apart. That is the spread that you're going to get when you're using a standard reconstitution. So just making sure that your injection points are close enough together that we're not missing any of those muscle fibers. When we're treating the frontalis, it's one muscle straight across. So if one area is left untreated, that's when you end up with recruitment, and you can see patient with spocked brows, and things like that. So just making sure that everything is evenly placed and we're treating all of those fibers to make sure we get a nice and even result. Now we're going in and treating the Procerus. I like to draw my toxin all in one syringe for the glabella area. So I have my Procerus dosing as well as both my corrugators in my same syringe. But as I'm treating, you always want to make sure that you are going in at a good depth. The frontalis does lie underneath the corrugators, and you don't want to give the patient a medial brow drop. So just ensuring you know where your needle is while you're injecting. And then again, just doing a lateral injection point here as well. For crow's feet, I like to find just that orbital rim and then making sure I am a little bit outside. And just coming in, and my needle is a little bit superficial here. We don't want to be too deep. And we're always following that muscle around. Again, similar to the frontalis, when we're not treating muscle fibers, that muscle is going to try to recruit and make up for the fibers that are not able to be moving. So it makes the muscle even stronger. So we want to make sure we're following that orbicularis oculi all the way around. If we miss those bottom fibers, I see this a lot. They can look like, it kind of gives like a shelf like appearance because they're going to start pulling a little bit harder on that lower part of their muscle. So always make sure that we're treating it all the way around where you're seeing that pull. And then here I am doing a little brow lift, and I'm going to do that on each side as well. For masseters, again, I already kind of spoke on anatomy here. We want to make sure we are going deep all the way into that muscle to avoid hitting any muscles involved with the smile. So I'm just wiping back from that, making sure I'm not pushing my toxin around. And then deep masseters, again, they're deep, like their name says. So you want to make sure we're really burying that bevel into the muscle. Again, finding the edge of my mandible here, making sure that I am right in the strongest part of the muscle there. And again, my deep masseter, just again, feeling right before I'm going in. You can't really tell because my hand is in the way, but I just had her clench and open one more time just to make sure that I liked my positioning. And that was a full neurotoxin treatment.